Hi, good evening. I'm Dr. Philip McMillan. Thank you for joining me. And today I'm sharing with you some information that I came across in the past day or two that really caught my attention. I have to be careful what I say here because this is an evolving story, but I'm going to try and put it in a context that makes sense to me as to why I think this is very, very important. There are a number of questions that I asked myself when I reflected on this. And if you want to hear a bit more details about the story and what's going on, you need to probably take a look here at my Substack. And this is about a healthcare worker that was arrested. I've got a short video in it and some very important links. And so this is an evolving story and something that is largely hidden in the sense that at the moment, very few people seem to know about it. And I'm trying to see if I can highlight what I think is relevant about the story without necessarily going into any specific details about whether it was right or wrong. So let's go to what was in the news story here. And this was essentially it. A health worker is arrested after COVID vax data was allegedly misused. This is from iNews, and they're talking about a situation in New Zealand. This is from Auckland here. Essentially, what they're saying, this healthcare worker has been arrested and charged after allegedly misusing and disclosing vaccination data. And he was using it to spread misinformation about COVID 19. And so he was actually arrested on Sunday. He should have appeared, he's 56 years old, and he should have appeared in the Wellington District Court today because this story was done yesterday. And essentially, the Te Watu Ora, if I've pronounced that correctly, which is the health department in New Zealand, has been granted an injunction that prevents any publication of the data by the Employment Relations Authority. So this data was then put in the public arena, and they're trying to close this down immediately because this data is unauthorized and it should not have been shared. And I understand that because from every company or every organization, from every government, this is relevant because you want to keep information confidential. And that I can understand. So let's get finish off this bit in the story here. So they were saying that he was involved in allegedly spreading misinformation about the COVID 19 vaccine. And he was claiming, this individual is trying to claim about vaccines is completely wrong, ill informed, and the comments demonstrate this. He apparently has no clinical background or expert vaccine knowledge and appears to be trying to spread misinformation. Okay, and again, as I said, I'm not commenting on the data. I have not looked at the data in any great detail, but this has been closed down very, very quickly. But there's a reason why this information is actually really, really important. So, before I get into why it's so important, I'd just like to make you think about something. And I reflected on this today. This gentleman, who is 56 years old, clearly a professional, dealing with data, and in his mind, he made a decision to share the data he was seeing publicly at significant personal risk to himself because he must have known that this data was confidential and he must have known that it would carry with it risk of litigation, potentially jail time, because he's currently in jail because of this. And I asked myself a question: what in the world would I have to see that would make me do something like that at personal risk to myself to share that kind of information? It really got me thinking. And I think it's a question that all of us should ask, is that why would he do this? What in the world could he have seen that would make him do this? So let's get back to the question as to why I think this here is very, very relevant. So I'm going to go back to what we know about what happened in terms of the pandemic. So New Zealand was a really valuable piece of research. And the reason was because what happened in New Zealand is that they closed down the borders and then they vaccinated the population. And so this data is from Our World in Data. So you can go and look at it yourself. And so you see here that this is showing the timeline from February 2021 here, going all the way up. And this is showing the share of people relative to population who received vaccination doses. So they started quite early February, and then they surged here in September into October. And then by about almost, well, January, they reached 76%, and they reached about 82% by February 2022. And then it has been largely flat. So this is the amount, the percentage of the population who had at least one dose. And you have to remember that I don't think at that time they were vaccinating children. So this almost covers all the adults in the country. Now, this was very important in my mind because I thought, from a research point of view, I was looking at autoimmunity as being the primary pathology. And so my question was, okay, what happens when they open the borders? Because at some point, they're going to have to face the virus. So, what we would want to know from a research point of view is, how did the outcomes go after they face the virus? That's the second part. So the first part is, it is the cleanest bit of data that we have got with regards to vaccination impacts on the population without COVID 19. Because in most other countries, you had COVID infection and you had vaccination. You just don't quite know which one is really the significant impact. In New Zealand, we had, as best as possible, the cleanest data that would demonstrate the safety of vaccination. I think that that's really important in times that you have lots of, as they say, misinformation. So, what happened when they then opened the borders? So, I've got here a comparison with Our World in Data, where I'm now looking at the UK in pink versus New Zealand. And you can see here in the UK, this part here, this is about January 2021. And so this is 2020 when they had the first surge. So this is 2021, big surge of cases. Then you see here, this is all the way up to January 2022. So this would have been on the Omicron spike. If you look at New Zealand here in blue, they were almost very low, not quite zero, all the way until here. This is February 2022. So this is when they had the first major surge with regards to Omicron. So they did not face the other viruses. They just faced Omicron in around February 2022. For one, you can see that Omicron was still able to evade the population. And you can see even now, going all the way to now, their levels are still higher than in the UK. It probably is that different places are measuring at a different rate. So that's not necessarily so important. But the fact that they then faced Omicron at that point is also really, really valuable information. What then happened in the context of the infection with the vaccination? This is really the best data we have in the world. And so my question is, why is that data not properly out there that it can be independently reviewed and verified? Because it's valuable. It's really, really important. So let's take it a step further because it got me to think about it. So I then did a few simple things. I just went to Mortality Watch, and this is looking at the age standardized mortality rate, which is looking at the population, but it kinds of makes sure that you balanced out your population according to age so that you have a better review of it. And you can see this is here. This is starting here in 2013, 2014, 2015, 2016, 2017, 2018, and this is here 2019, 2020. And you can see here it's at the lowest point right here. But this would have been around the time of COVID when it was closed down in New Zealand. So their age standardized mortality rate was at the lowest point here. You can see in 2021 it started to rise, but it's still lower than it was before. And then it peaks here 2021 to 2022. And this is higher than the trending line that you can see here. Now, whichever way you take it, at this phase here, the only impact would have been vaccination. So the question is, why did that occur? Is that actually what we would expect? Would we expect to surge above the trend, especially when people were still in lockdown? Well, maybe they weren't seeing their doctors or they were having other issues going on, but that still needs to be clarified. And this is what I'm saying is that it is such a clean piece of data that it is extremely, extremely valuable. Similarly, if you looked at the crude mortality rate, that's just the amount of people who died, and you didn't take out any particular age standardization, you can see again here that this was the trend. This is deaths per 100,000. And you can see here in 2014, it was 668, then it was 687, then it was 658. So you can see this up and down trend. And then down here, this would have been around the beginning of COVID-19. They had zero, almost zero COVID, 642 at the lowest point. And then again, you see here, 2021, 677. Then it goes to 736, 725. So this is still trending way above the normal. And at this point here, this is now a combination of COVID and vaccination. But this here, at this point, is this just about the vaccination program? This is really, really important. And so I understand that New Zealand doesn't want valuable data just shared, which could probably give information about a patient, and they want to keep that relatively secure. I understand that. But there is still a very important responsibility that we need to see that data. The world needs to see it. And listen, this is could be the way that they demonstrate as conclusively as they have been saying all the time that there is no concern. For people who are raising concerns and having questions, there is no better way to quell all of it by looking at the data in New Zealand, because we have nothing better. Australia is about as good, but New Zealand, because it's a smaller island, there was less movement, it was a really tight lockdown, probably represents our gold standard when it comes to seeing what impact does vaccination have on population health, and what impact does the combination of Omicron and vaccination have on population health. These are all very important questions. And again, as I said to you before, if you want to read a little bit more about it, that is can't really be said here, then just please go to the Substack. You can see the video. You can see a link to what some of the analysis is. And that's up to you to read it and reflect on what it could mean. But my point is simple. This data is valuable to the world. It's valuable to research. And I would hope that New Zealand doesn't need somebody to risk jail time to get important information out if it is very relevant. And here is the point. Let's just say this gentleman who did this ends up in jail because of what he did. Let's just assume that what he did was correct and there was really valuable information that should have been shared that wasn't. It means that every single person who was involved in not sharing that information should suffer a similar fate. I think that's a really important differentiation point. And if we're going to do a rule like that for something as serious as what we have at the moment, where we need answers, and if answers are out there but not being shared, I think that that is just as serious, if not more serious, than what has been done. But I'll leave the judges to make their decisions, and the police have to do their job. And this person, whoever he is, I stand and say, you have done something that I'm not sure I could have done. And I don't know many other people who would. Have a great evening. Thank you.